So today we are going to be palpating the lower leg and the ankle. We're going to divide it into sections. So first we're going to start with just general bones, the calcaneus, talus, navicular, lateral, middle, and medial cuneiforms, and the cuboid. Then we're going to move on to talk about the landmarks, which is going to include the lateral and medial malleolus, the navicular tubercle, the head, the neck, and the dome of the talus, the sustenaculum tali, the peroneal tubercle, sinus tarsi, inferior tib-fib joint, dome of the calcaneus, and the medial tubercle of the calcaneus. We will then move on to talk about some of the softer structures, such as ligaments, which include the deltoid, which within the deltoid consists of the anterior and posterior tibiotalar, the tibiocalcaneal, and the tibionavicular. Moving on, we will then go to the anterior talofibular, then the calcaneofibular, then the anterior posterior tibiofibular, and then the plantar calcaneonavicular, also known as the spring ligament. Then we will move on to tendons, and we will finish up with tendons. We will start with the tibialis posterior, which is also known as TOM. I'll show you a fun way to remember those when we start palpating. Then the flexor digitorum longus, also known as Dick. Then the flexor hallucis longus, also known as Harry. The tibialis anterior, the extensor digitorum longus, the extensor hallucis longus, and the peroneus longus and brevis. So first, we're going to start with the bones of the ankle. We're going to start with the calcaneus. So, in order to palpate the calcaneus, it's basically the heel. So where this X is, it's going to be this entire heel. Then we're going to move on to the talus, which sits right on top of that. And in order to palpate that, you kind of have to use 2 fingers to pinch, and you're going to have to move the foot slightly, invert and evert. And it's going to be right where that X is, right there. Then we're going to move on to the navicular. As you move distally from the talus, it's going to articulate with the end of the talus, the distal end of the talus. So if you move distally, you're going to feel this little bump. That's going to be the navicular. And that is also going to articulate with the medial cuneiform. And that is also going to line up with the first metatarsal. So as you palpate the length of the first metatarsal, right when you get past that base, you're going to feel the medial cuneiform right there where that X is. As you move, you're going to palpate the middle cuneiform. Then you're going to palpate the lateral cuneiform, and those are going to line up respectively with the second metatarsal and the third metatarsal, right at the ends of the bases. Then, as you move more lateral, you're going to palpate the end of the 5th metatarsal right here. You're going to feel that. It's going to be a nice little bump right there. And you're also going to find this structure, which we'll talk about next. And then you're going to move about 1/2 inch towards that structure, and it's going to be right there. You're going to feel it right about there. And that is the cuboid. So now we're going to talk about some of the landmarks. I already named these, but we're going to talk about a couple extra, but mainly these are the ones we're going to focus on. So first, we're going to palpate the dome of the calcaneus. So how you're going to do this, it's basically the heel. That's your calcaneus. But as you see this line, you can go ahead and palpate on the ends of that line, and that's going to be the dome. As you move distal, you're going to palpate the medial tubercle of the calcaneus, and that's just basically the medial heel. You can feel a slight landmark right there, but it's hard because you have such a big thick pad right there. So then we're going to move on, and we're going to palpate the medial malleolus. This is the end of the tibia. It's going to be right there, that little ankle bone right there where that X is. Then you're going to move distally, and this is going to be the sustenaculum tali. It's like a little shelf. It's going to be on the calcaneus, and you're just going to move distal from the medial malleolus, and you're going to feel this little shelf right here. The flexor hallucis longus tendon is going to run right beneath it. That's kind of what this is used for. As you move distal, you're gonna go ahead and palpate the peroneal tubercle. It's gonna be a little bump. So just move in a straight line towards your big toe and you're gonna feel that little bump right there. Then, as we move laterally, you're going to feel the dome of the talus. The talus, remember, is the bone that sits right on top of that calcaneus. So in order to palpate that, you're gonna have to kind of use your pinch your fingers, pinch, invert and evert the foot, and you can really feel it. You can feel those two ends, the dome right there. Okay, then we're moving on. This is really hard to palpate, but it's the distal tib-fib joint, the tibia and fibula joint. It's kind of hard, but you can kind of feel it. If you dorsiflex, it kind of spreads those two bones apart and you can kind of feel it, but it's really hard to palpate. It's kind of with that line right there. As we keep moving lateral, we're gonna palpate the fifth metatarsal, the tuberosity of the fifth metatarsal, or the styloid process, whichever name works. So we're gonna move, we're gonna palpate that bone right there. You're gonna feel a nice little bump, a nice little shelf. It's gonna stick out quite a bit. A lot of fractures occur here because it sticks out so much. It's gonna be right there. Okay, so as we keep moving, the lateral malleolus is the lateral ankle bone. It's gonna be the distal part of the fibula, and right beneath that, you're gonna feel a depression, and that is going to be the sinus tarsi. It's just this little depression right in here. You have to really kind of palpate right below that lateral malleolus to feel it. Okay? So, from the lateral malleolus, just like on the other side where the sustaneculum tali is, this is where the peroneal tubercle is going to be, but it's going to be slightly more distal. It's going to be just another shelf right there. That's where the peroneus longus and brevis are going to run, right over there. And you feel it right there. So from that last part, I just want to clarify that this is the navicular. This is not the peroneal tubercle. This is the navicular tubercle right here, because the navicular bone is right here. The peroneal tubercle, as I mentioned later, is going to be right below the lateral malleolus, just to clarify, right there. So now we're going to talk about all of the ligaments of the lower leg and the ankle. So, to start, we're going to palpate on the medial side, and it's going to be the deltoid. And that is going to consist of the anterior and posterior tibiotalar, the tibiocalcaneal, and the tibionavicular. So these are all going to start from the tibia, and they're going to branch out to these bones. So it's going to be all in this area right in here. Then we're going to move on to the calcaneonavicular, the plantar calcaneonavicular, also known as the spring ligament. So as she inverts, it's going to create a nice little taut spring ligament right there, and you can feel it if you run your finger against the fibers. You can kind of feel it right in there. It's going to be right there. So as we move laterally, we are going to palpate the anterior and posterior tibiofibular ligaments. Obviously one's going to be on the anterior side and one's going to be more posterior. It's going to kind of run like this, not necessarily directly across. It's going to kind of run at a diagonal. And it's hard to palpate these, but if you look at a picture, it's easy to see that they run right in between the tibia and the fibula. Okay, so moving on, we're going to palpate on the lateral aspect near the lateral malleolus, the anterior talofibular and the posterior talofibular, and this is going to be the calcaneofibular ligament. They're all going to kind of run right around here, right here. Okay, so now we're going to talk about the tendons in this section. To start, we are going to start on the medial side with these structures. All of these structures that run behind the medial malleolus, an easy way to think about this is Tom, Dick, and a nervous Harry. So Tom, the first one, is going to be tibialis posterior. Dick, the second one, is going to be flexor digitorum longus, and is going to be an artery. It's going to be the tibialis posterior artery, and is going to be a nerve. The nervous nerve is going to be the tibialis nerve, the tibial nerve, and then hairy is going to be flexor hallucis longus. So that's an easy way to remember all of those. So as we move lateral, I'm gonna have my patient dorsiflex, and you'll see right here the tendons that are already starting to pop out. This first one right here, this big one, is tibialis anterior, right here. As we continue moving laterally, this one is going to be the extensor hallucis longus. It's going to control the big toe, the extension of the big toe. Then, as we continue moving laterally, this is going to be the extensor digitorum longus. This is going to extend all of these toes, 2 through 5. Right in between those two, the extensor digitorum and extensor hallucis, is going to be the dorsal pedal pulse. This is a good way to find a pulse if you're looking for one in the foot. So as we continue moving this way, laterally, we have the peroneus longus and brevis tendons. So this is where they're gonna start, and they're gonna run down and around the lateral malleolus. The brevis is going to branch off on top of the longus, and it's going to end right here at this tubercle of the 5th metatarsal. And then as the longus goes, it's going to go actually here and then run under the foot. And that's how those are going to run. They're going to split right here.